So here's the second video in our series on ligamentous injuries, the types of injuries that we see in whiplash, and how we prove those injuries in these days of litigation and everything, so that people get the care that they need and whatever else they need, but so that they get the care that they need and get as well as they possibly can. It's very important to understand that whiplash trauma, whiplash injuries cause stretching of the cervical ligaments beyond their anatomical ligament or limit. So ligaments prevent excessive motion, okay? They don't prevent motion, okay, but they prevent excessive motion. So in other words, if the ligaments get damaged, then the joints can move too much. So in whiplash injuries, hyperextension, that's when you initially get hit from the rear and your head goes back like this, okay? That's what happens initially. It's proven to cause damage to what's called the anterior longitudinal ligament, as well as to facet capsular ligaments. They're in the back part of the spine, and those joints are kind of slanted like this in the back part of the spine. Now studies have proven that 50 to 60% of the victims of chronic pain that lasts more than 1 year after a crash have facet joint injury as the primary source of their pain. Those joints in the back part of the spine have what's called nociceptors in them. And nociceptors, when something's damaged, it causes pain. So there was a study by Lord, a gentleman named Lord, and a bunch of other people that said chronic cervical zygapophyseal joint, those are the facet joints in the back part of the spine, after whiplash. It was a placebo-controlled prevalence study, and it was published in the Journal of Spine, 1996. Now, recent research reported in the Journal of Biomechanics reported that injury to the apical and the alar ligaments is common as the result of whiplash trauma, or cervical acceleration deceleration trauma, with damage to the alar ligaments occurring in 66% of whiplash victims. The alar ligaments keep the head and the cervical spine connected. So when they get damaged, there's too much motion, especially going from side to side. Hyperflexion, and that's when, after you get hit from the rear, your head goes forward as the car comes to a complete stop. That's been proven to cause damage to what's called the ligamentum flavum and the interspinous ligaments. So just number 2 in our series on whiplash injuries, how we prove them, how we find out what's going on with the patient, and how we determine if possibly they're going to have chronic pain for the rest of their life, or if it's just going to be a transient type of pain. Stay tuned for number 3.